Thank you. Well, it's an honor and a little intimidating, I have to say, to be standing here in front of all of you. I've known many of you for a long time, but I've never presented to any of you. So, needless to say, the presentation has gone through a few iterations, including just this morning, frantically trying to make sure that what we were going to talk about today was relevant. So, I've been on a quest for a long time, and the reason that I got involved in doing what I do today was because I really believe that people deserve to have access to the tools and information that they need to make better decisions about health for themselves and their family, no matter where they are in the world. And so, I think pretty aptly so, we named the company Viable Synergy. And so, we are a people-first innovation and technology firm, and we help health innovators bring their ideas to life to transform the world. And what I'd like to do today is help you think about how we think about problem solving. And so what we really specialize in is helping health innovators find ways to make money with the things that they love doing. And that includes hospitals and doctors' offices and individuals. And we typically approach it pretty simply. You can keep three primary problems in mind. Whenever I go to start thinking about how I'm going to fix something, I think about three things. One is, what is the problem? And you've got to layer the problem. It's not just typically what you see on the surface. It's usually something beneath it. So you start exploring what the problem is. So what's the problem? And then who would benefit most? And this sounds simple, but in healthcare we know that's really complicated. And then the third and really probably one of the most important, they're all equally important, but one that's really important that often gets completely overlooked is who would be willing to pay, have the ability to pay, and why would they be willing to pay? So I'm going to give you a few examples I'm going to give you two examples of projects that we've either recently worked on or we're currently working on following this methodology. So the first thing is I do work with some large clients, and they need more than 3 questions to really be able to dig down into problem solving. So we use a methodology that we call a value-driven innovation process, and it's understand, identify, create, communicate, and then scale the successful solutions. And of course, we could probably spend a couple hours on this, but we're not going to do that today. We're going to dig right into the application. So here are some use cases. So Cincinnati Children's is one of our clients. And if you don't know about Cincinnati Children's, it's unusual to have such a high quality, highly esteemed organization in a city the size of Cincinnati. There's only about 1 million people. But the city of Cincinnati, all the healthcare institutions got together and said, you know what, children really, really matter, and we are going to have one really good children's hospital instead of having 3 or 4 organizations that take care of kids. And what it's translated into is an organization that receives the 5th largest amount of NIH funding in the country, in the world, too, because it only funds in the U.S. So what problem did they have? They needed, the group that we worked with in this example needed to find a recurring revenue source. A very well-established organization. They've been around for like 14 years. They had 426,000 home visits they delivered. They served 19,000 families. And they were really, really good at a very high-touch way of delivering care to at-risk mothers, to help the mothers to have children who were prepared for kindergarten, for kindergarten. So they wanted to take a piece of this expertise and create a way to generate recurring revenue. And that way was some kind of app that helped parents to remember to talk to their kids more. And that sounds like a simple thing. Parents do that all the time. Actually, they don't. And the level of importance is incredibly significant. So the number of words that a child hears before they enter kindergarten pretty much determines their entire trajectory in life. They go into 3rd grades, the government does, to determine how many prisons to build. There's that much of an impact. It's very significant. And so they really wanted to figure out how can we become more sustainable. And they wanted to create an app and take a sliver of what it is that they do, deliver it in some kind of application form that was took just a little bit of effort from them, and they could use it to generate revenue. So the first question is, just because you can deliver effectively your expertise in a very high-touch way by doing home visits, how do we know that you can take any of that and deliver that, and these are at-risk families, how do we know that you can take any of that and deliver that same knowledge and expertise to a completely different demographic using a digital format? And we really questioned, is that really possible? And so the first thing was we had to figure out, do people who have disposable income, do they care about this type of content, and would they want to receive it in a digital way? So we did focus groups, and it was pretty simple. We just invited people at Cincinnati Children's, they have over 6,000 employees, to attend a series of focus groups. Now the concept was simple, but the deployment and figuring out how to do that was a whole different story. But what we found was that, first of all, a very diverse group of people joined us. So we had everyone from like attorneys who had children, male attorneys who had children, to people that ran the Child Life Center, to people that worked in the kitchen, to female directors of departments who came in and went through the focus groups with us. And it was an age range from grandparents to people that had, there was an IT guy who just had a new baby. So he's young, and so we had a nice representation. And what we found was that they loved the content. They absolutely loved the content. And they wanted to receive it in all kinds of ways. So what did they like about it? They liked that the activities were simple and clear, that they were validating and reinforcing, and they wanted to have a solution that was easy to use and offered opportunities for praise and reinforcement. They also wanted some reminders. And one person that was...
Was this just disposable income or level of
we didn't get that sophisticated yet. So this is the early stages. We're in the very, very MVP phase. So we validated the fact that there was a desire for people who had that were outside their current demographic, who were not first-time moms living in very at-risk areas, that they wanted to have the content. So the next step was to start to see if we could take that content and actually deliver it in a different vehicle. There were lots of iterations. There's not a lot of time to go through great detail. I'd love to talk with you more about more details if you'd like it, but I'd like to make sure that we can talk about a couple of different examples here. So what we offer as part of our solution set is a platform called Innovation Station, which is a highly modular platform that would allow them to get started very quickly and iterate quickly. So we used our backend platform, the Innovation Station, along with an application we created called Health Nudge. And we were able to very quickly take their content, redesign it, or put a nice front face on it, and then get it to someone who would be willing and able to pay. So, quick few examples. Who do you think might pay for this? So their target audience are families with disposable income. So who do you think you might automatically go to get to pay for it? The families, right? That's what most people think. Yes. That's a good answer. But we know people don't buy apps, right? They don't pay for them. So, this is one of the reasons I wanted to present this to you, because I think so many of you have incredible ideas solving real problems, and we need to get more creative about where we're going to get money for them. So, what they did is they went to a company called Procter & Gamble. Maybe y'all heard of it? P&G, right? Procter & Gamble. And they went to, where in Procter & Gamble, what brand would be perfect for their target audience? Pampers. Pampers.com. So we were able, they had tried for 6 years to take slides and try to sell this content to Pampers. And Pampers is like, what are we going to do with a binder? What are we going to do with a bunch of slides? But now we brought them a web-based application that they can create a community. We validated the fact that their audience would be interested in this type of content, not to the level that P&G typically would, but it was enough to let them know that we knew what we were doing. And what they ended up doing was they gave this group, they gave them $50,000 to build out the rest of their content, and probably even more they marketed the application to their Pampers.com subscribers, which they had a whole bunch of them. And there's, some of the information proprietary. What I'm sharing with you is in the public domain. But they received not only the money to build out the rest of their content, but promotional support to get more people using the application, joining, and so that just is a self-perpetuating process, right? So just the kind of takeaway from this is there was a clear problem, there was a clear need, and we found an innovative way to get the program funded in a way that was synergistic between both the pilot, the organization, Cincinnati Children's, as well as Procter & Gamble. So the next use case is St. Elizabeth. So St. Elizabeth is a regional medical center. They did about 1 million patient visits last year. They have 400 physicians in their group, but they're in northern Kentucky, okay? Northern Kentucky, honestly, it's a little bigger than Grantville. It's probably a lot bigger, but it's still Kentucky. And so unfortunately, yeah, we still have this vision of rural, small, backward, don't know what they're doing. Let me tell you something. This place.
My mom.
So this organization, they care so much about their patients, and they take such an innovative approach to the things that they do. And they're super innovative because they're just solving problems, and they just don't even realize it. They keep telling me, Sunnie, I just can't understand why this is innovative. I'm like, well, let's talk about that some other time. Anyway, so what was the problem? So we're going to talk about precision medicine now. So St. Elizabeth was interested, their chief strategy and growth officer was interested in providing more personalized care to their patients. Now she was interested because she thinks that's the right thing to do. She also sees a business opportunity to differentiate that organization from all the other hospitals that are tremendously competing in the Cincinnati area. I mean, it's bad after the Affordable Care Act. So, and she has never really been able, like, St. E's is just good at everything they do. Nobody sees them as being really great at anything. Not that they're bad at anything. It's just they're kind of good at everything. And in order to really be able to grow, people need to see you as great at something. So she said, we're going to be great at personalized care. So about the same time, a friend of mine at the White House reached out, and she's working on this precision medicine thing. I'm like, I don't need one more thing to get involved in. I've got way too much stuff going on. She's like, please help me find something to highlight at Cincinnati Children's, actually, which I had in the slide, about examples of precision medicine. Because they are doing a lot at Cincinnati Children's. But I couldn't get anybody to move there. They just weren't seeing the opportunity. But I already had this opportunity at this Northern Kentucky hospital. So I'm like, Maya, would it be okay if we use this? We're already working on this particular with this particular hospital. So what did that look like? So St. Elizabeth is in Northern Kentucky. Cincinnati Children's had technology, intellectual capital that they had patented, that they spun out and created a startup company called AssureX, which is it's a pharmacogenomics company that's literally 20 miles from Northern Kentucky. So when I was talking to St. Elizabeth, I said, you want to do more personalized care? Let's start talking to St. Elizabeth. Because remember I talked about synergy. Let's start talking to AssureX, which is 20 miles away, about how we can leverage their pharmacogenomics test for something at St. E's. So what ensued was a lot of enthusiasm from both St. E's, some from AssureX, it's growing, and from the White House. And so what happened, so the problem, I told you the problem. The benefit and who pays was the same. Because St. E's already was aligned. So they knew the benefit to them and to their patients were aligned, and so it was easy who was going to pay. So then the solution was we developed a precision medicine demonstration project that's going to translate these scientific findings from the AssureX company that's actually been around for 6 or 7 years. But their method of selling their test is doctor to doctor to doctor. So we're going to take that whole process and we're going to implement that as a standard of care across St. Elizabeth. And then we're going to take the information, we're going to be able to share how you operationalize the practice of precision medicine and publish that in ways that more people can get to it faster than waiting for the time frame to publish it in a peer-reviewed publication. And we're going to use that technology I showed you earlier, Innovation Station, to make it easier to be able to quickly publish results and share best practices and start discussions. And I have 2 minutes. So the early results, we were invited to the White House. They had a Precision Medicine Summit in February 24th of 2016. So I got to bring Sarah. We went to the White House. There were 40 other organizations that were there. There were about 170 people. My client, was totally over the moon, right? Because she gets to go to the White House. And we got a whole bunch of press. They got a lot of press and media coverage, which also helped her because she'd been trying to get more media coverage about the good things they were doing at St. without being part of everybody else, right? So now St. is now in the news about the cool and innovative things that they're doing around personalized care. So she's raising the brand of her organization in the community. We're highlighted on the White House blog. The White House got another story about what the president wants to do is happening in the community, and I got to be part of that, getting paid for the work, our solutions being used. And so the next steps are that we're actually really doing this. We are really in the trenches in this hospital, figuring out how do we take a pharmacogenomics test that's going to help in behavioral health. We're starting with behavioral health for depression. And I don't know if you know much about what happens in Northern Kentucky, but you talked about addiction, opioids, and things like that. We're like the heroin epidemic in the world. We have more people who get pulled over for driving on heroin than driving on alcohol. And so we're going to be able to use this new test to help improve depression outcomes, which hope will reduce addiction and all kinds of other great things. But we're at the very beginning. So, takeaways. Just remember these 3 quick and easy things to kind of think about. Anytime that you get in that place where you put on your activist hat and say, this is such a big problem, I want to solve this. Well, think about who will benefit most. And don't forget who would pay, why would they pay, and then make sure you align those things together. And if you have stories about things you might want to brainstorm about, just to work through this process, I'm here until we have to leave for the airport on Saturday, which is like midday. Would love to talk with you about it. It's a fun process. Thank you. It's been an honor to be able to be here with you today.
Our next speaker can come forward with her laptop. Ready to the next projection. Sunnie's amazing, isn't she? Never was there a person better named.